Hey guys, welcome back. Speech number 5. So how many of you know someone with Down syndrome? Boom, 1, 2, 3, 4, 5, all of you. How many of you know someone with 22q deletion? 0, exactly what I thought. 22q deletion is a chromosome disorder that occurs at birth. My little brother happens to have it, that's why I'm so informed on it. He was born with 3 holes in his heart, which is a symptom of 22q deletion heart disorders. He has problems progressing in the classroom and socially, which is also another aspect of 22q deletion. A few other things that come about with this disorder are breathing problems, kidney abnormalities, low levels of calcium in the blood, which results in seizures, and then a decrease in blood platelets, significant feeding difficulties, which my brother does also happen to have that every now and then, just complains about it mildly though, not like some other cases who have very difficult times eating. Gastrointestinal problems, hearing loss, skeletal differences are possible, but most of them don't have them. It's more a rare case. Many children with this 22q11.2 deletion syndrome have also developed delays, which my brother also has. He, like I said, in the classroom and socially with friends. Later in life, they're at increased risk for developing mental illnesses because this disease is an immune deficiency disease. So they have a bigger chance of becoming schizophrenic, having depression, anxiety, bipolar disorders, and additionally, most children that are 22q develop autism. Not sure mild or severe, it depends on the child, or ADHD, attention deficit hyperactivity disorder. The development, actually, because the signs and symptoms of 22q deletion are so varied, different features were once described as separate disorders. So all these different features that I described throughout the presentation were put into categories of different diseases and disorders. So for a few of the disorders that they were thought to be were DiGeorge syndrome, velocardiofacial syndrome, also called Spritzen syndrome, Conotruncal anomaly face syndrome, and also kids were diagnosed with the autosomal dominant form of Opitz GBBB syndrome, Kaler-Cardofacial syndrome. Once all the genetic disorders were put together, they came about to believe that they put all the disorders into one to classify it as 22q. How many people have this disorder? Well, it seemed to be 1 in 4,000 people have this disorder. However, the condition can be so mild that there are many unidentified and unclaimed cases of 22q. So my brother was luckily found and taken care of quickly. If he hadn't had the heart disorder and the holes in his heart, we probably never would have known that he had this disorder. Researchers are working on identifying all the genes that contribute to the features of 22q. They determined that the loss of the particular gene in the 22nd chromosome in the middle is from TBXI, probably reasonable for many of the syndromes, which is probably reasonable for many of the syndrome's characteristics, as in heart defects, cleft palate, distinctive facial features, the hearing loss, and the low calcium levels. The other part of the deletion in the gene may contribute to behavioral problems as well, which is COMT, which is in the same region of chromosome 22, which may also help increase the risk of behavioral problems and mental illnesses in these children that are diagnosed with 22. And is this an inherited disease? It's considered an autosomal dominant because the deletion in one copy of chromosome 22 in each cell is sufficient to cause a condition. But it's said that inherited cases, other family members may be affected as well. So affected people typically have no history of disorder in their family, though they can pass the condition to their children. So there it is for 22q deletion, guys.